This article is about the epidemiology of aortic aneurysms in the US. As you all know, the last published data is from the 80s and there has not been a modern update. We do not know if the supposed rates of aneurysm occurrence have changed in this population, and that is what this article addresses. Hi, I'm Indrani Sen. I'm a consultant of vascular surgery practicing at Mayo Clinic, Eau Claire. I'm going to talk to you today about rates of an abdominal aortic aneurysm repair in women are higher after treatment in comparison to men. Over the last 40 years, this is work that has been done with me and with Dr. Kalra, who's a professor of vascular surgery at the Mayo Clinic, Rochester. This is an epidemiological study that has been conducted using data from the Rochester Epidemiology Project. The study included 1,537 patients, 75% were male with a mean age of 74 years. A diagnosis of an abdominal aortic aneurysm was made at presentation with rupture in 95 patients. 75% presenting before and 65% after the Medicare screening guidelines. Only 16% of aneurysms were detected on screening. Patients with incidentally detected aneurysms were older, had larger aneurysms, and were more likely to present with rupture. Overall survival was lower than controls. And in addition, women presented with a relatively higher rate of rupture, which has not reduced in the study time period. So, what this means for clinicians is that since the introduction of screening and the widespread application of EVAR, the changes of these introductions was not well known. But we now know that screening has not been as widely accepted as we would have liked it to become. In addition, we know that rupture rates in men have reduced dramatically over the last 40 years, but those in women have not really reduced. Women are still not a category where screening is thought to be effective, and these poses some larger questions for future study. With regards to treatment, again, we think that women usually do poorly after aneurysm repair, but what our study shows that this is mainly because women are nearly a decade older when their aneurysms are being repaired. It's because they are not screened. So usually people have had some CT, something in the past. But if they have a family history or if they have smoked, those are, I think, the first groups to target. And men kind of get it when between 65 and 75. But in women, it seems that it's mostly in their late 70s and 80s. And now with the population living longer and longer, many women are healthy, functional, and older. So to not know and then need treatment emergently, that's a big thing women face, which the men perhaps don't face as much. But overall, the disease remains more uncommon in women. So in the future, we have to figure out some way of predicting who will get it. How do we figure it out? Who will get it in women? And those are some of the future areas of work. So to summarize, this paper on the epidemiology of abdominal aortic aneurysms in the US provides data on the epidemiology of the disease in the last 40 years. The rate of rupture in men has reduced dramatically. In clinical practice, we find that the relative rates of rupture in women are higher in comparison to men, and this is borne out by the study as well. Women are older when they present with aneurysms, and in our study did not do worse after treatment in comparison to men. And with this, I invite you to look at the link and read our study for the other details.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, Our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.